and then passes to the ureter on both sides, okay? And how long is the ureter?
1.5.
So
20,
15 centimeters.
Right, something like that. Okay, and then it goes all the way down. So we have three constrictions. So you can tell me the three constrictions of the ureter. So we have one constriction in the uteropelvic after it passes the kidney. We have one constriction after it passes the common iliac. And the other constriction is where it opens to the wall. Okay, so here, so this is like the intramural part. It opens to the wall. It moves obliquely. Okay, and that's a constriction over there. Okay, and then it opens to here. As you can, this is the trigon of the urine. Okay, this is the bladder, by the way. So basically, that is about it for the ureter. It opens on the posterolateral aspect of the bladder. So this is the trigon, right? On either side of the trigon, we have the ureteral orifice, ureter opening, or ureteral orifice, the trigon. And it's the bladder. Okay, I don't know if you can see it in the pelvic cavity here. It's the bladder. So you have the peritoneum covering the bladder. Okay, this is the male ureter. This is the rectum. So the peritoneum covers the rectum and then jumps on the bladder, and it forms what pouch do we find here? Rectovesical pouch. Right. Rectovesical pouch. In females we have two pouches. This is the rectum. We have the pouch over here, which is Douglas pouch, the rectovesical pouch here, and here we have the vesico-uterine pouch, recto-uterine pouch, vesico-uterine pouch here. So this is deeper. The recto-uterine pouch is deeper, and we also refer to as the Douglas pouch. And this is the main place where the fluid accumulates, and the other place is what? Morrison pouch, which is also referred to as hepatorenal recess. Okay, so it's a recess. It's like a pouch, like a pocket. It also accumulates in that. So these two important are areas that mostly, if there's a hemorrhage, or if there might be like a rupture of ectopic pregnancy, the blood might accumulate in these two areas. Okay, so that's that. The bladder, urinary bladder. This is the urinary bladder here. Okay. And it's like this. It sits like this. All right. So we have the superior surface here. We have the apex. We have the base at the back, and we have the inferior lateral surface. Inferior lateral surface. This is the posterior surface of the base, apex, and then we have the neck. Neck is primarily hooked up on the prostate, as you can see. The neck. Okay. And on the posterior, or the base of the bladder at the back here, what we see here, we have two important things here. We have vas deferens, right, and then the other is seminal vesicle. So vas deferens, that comes from the testes, that connects with the duct of the seminal vesicle, forming ejaculatory duct. So these two come together, they form the ejaculatory duct. Ejaculatory duct, which is located where? Okay. So basically these two, they form ejaculatory duct. I don't know where we can find that ejaculatory duct in the. Yeah, that one. Oh, I have that right here. Yeah. Okay, so this is the anyhow. So okay, anyhow. So these two ducts come to, they form the ejaculatory duct. And ejaculatory duct opens to the prostatic urethra. Prostatic urethra. Okay, so this is the prostatic urethra. Okay, this is the intramural part of the urethra, prostatic urethra. Here is the membranous urethra. The membranous urethra is located where?
Level of the diaphragm.
Urogenital diaphragm, right. And then after that, you have the penile urethra. Okay. So we talked about the urinary bladder. Okay, I think that's about it for the urinary bladder. And then we have the rugae. Okay, the rugae of the urinary bladder, and the muscle is called detrusor muscle, right? Detrusor muscle. Trigon, and we have 2 urethral orifices. And then that opens to the urethra, which is this area here, this area here is the urethra. This is the intermembranous part, prostatic part, intramural part, prostatic part, membranous part, where you have the urogenital diaphragm, you have the penile urethra. So which area is the most constricted? Which area is the most dilated?
Most dilated.
Okay, so let's look at first the constricted part. Which area is most constricted?
Membranous part is most constricted.
Okay, if we exception of the
External
urethral orifice. So the most constricted is basically the external urethral orifice. So the most constricted is the external urethral orifice, okay, the most. But if we exclude that, if we don't add that as a part of the urethra, it's the membranous part, which is this part here, the membranous part. Okay. How about the most dilated part? Yes.
Prostatic part is the most dilated.
Right. The prostatic part is the most dilated part of the, and then we have the bulb of the urethra, where the bulb of the penis is located. The bulb, it's also dilated, but the most dilated is prostatic part of the urethra. Okay, so that's